How did you get the owner and vet to keep looking for pain after the initial exams and imaging looked okay? What made you keep looking rather than accepting the clean bill of health and moving on? And this was left on a video where I mentioned that I've had 2 clients just this month whose imaging was initially said to look okay. And then with deeper digging, we found out that wasn't true, one of whom actually had a broken bone. That pup saw 3 vets before being properly diagnosed with a fractured femur. So let's talk a bit about what that process looks like. First, as a behavior consultant, I know that statistically speaking, the vast majority of my clients are being impacted by physical health concerns. And a lot of times this gets misunderstood as something that we sort of check for before we begin behavior therapy. And then the dog gets a clean bill of health, they are said to not be in pain, and we move on with behavior therapy. But that's not how it works. There really is no such thing as a clean bill of health, particularly with a species who can't tell us directly how they're feeling in their body. There is no test for pain, and so that's not something that we can rule out. We want to stay curious about how the dog feels in their body throughout the process. Part of what I am able to do through continuing education, through staying up to date on the latest literature, and just through practice and experience, is to notice the really smaller, subtle, seemingly unrelated signs that can pop up when a dog is in pain and help put it all together. Some of these things are bright red flags. Other things are just interesting until you put them together with like 6 other interesting things. Next up, I need to loop in the client. And this can be hard because people don't want to believe that their pup has been in pain. So I talk to my clients about how most dogs who are experiencing chronic dysregulation are also experiencing physical health concerns. I talk to them about how that's true for my personal client history, and I reference the Mills study. I have a lot of resources, quick resources, Instagram posts, short videos, brief articles. Many of these are by veterinarians, dynamic dog practitioners, physical therapists, and they're sharing information related to what I'm telling the client. How picky eating can be a sign of pain. How 20% of dogs over the age of 1 have arthritis. Different things that we think are normal but aren't, about how a dog moves or rests. So in the same way I teach my clients about body language so that they can understand their dogs directly, I teach them about identifying pain in dogs so that they can see the same things I'm seeing directly. And they don't have to take my word for it. And then I prepare them for what this process looks like and that it is a process. I let them know that most of the time, what my clients are experiencing is not found on your annual exam or blood work. I let them know that sometimes we get lucky and that's the case, but more often than not, the exam looks fine. And I let them know why. Oftentimes my clients are sedated or very stressed at the vet and when being examined. And often by the time we can see something on exam, it is significantly progressed, depending on what it is, of course. But these are higher levels of pain, and often the dog has been living for years, sometimes for most of their life, with behavior as the main symptom. And so I prepare my clients so that they understand that we cannot rule out pain and that we are unlikely to find something on exam, and that doesn't mean that there is no pain. I tell them that often my clients have to see multiple veterinarians, specialists, before they find answers, but that they do tend to find answers. And then I have resources for my clients. I talk to them about how they can talk to their vet, using phrasing like, if I wanted to continue investigating this, what would my next steps be? And I have other folks that I can refer to, so folks who can do an in-depth gait analysis, veterinarians or physical therapists who perform pain assessments. Clients who live locally to me have access to thermal imaging, and that can sort of help us cast a broad net. I share scholarly articles that they can share with their veterinarian on things like pain medication trials. Importantly, it is never my job as the behavior consultant to say, I think your dog has X going on. Personally, I know just enough to say that's not right. Let's dig deeper. Although becoming a dynamic dog practitioner is on my continuing education wish list in the future. Those guys are really good at bridging the gap between behavior consultants and veterinarians. And this is an ongoing process. So sometimes we take the answers that we are given, we make adjustments to the environment, and then we continue to gather data, we continue to watch. And sometimes it's weeks or months down the road where we go, wow, this is a really interesting pattern. Some days your dog is completely fine with this trigger, and other days they have a really hard time. We have this inconsistency that can't be explained by other external factors. Or interesting, we've really hit a plateau in this spot. Or wow, we introduced this exercise and your dog is resistant to it, or they do it in a really interesting way, or whatever the case may be. Now we have some more data to add to our running list of data to say what's going on there. Bottom line, chronically dysregulated dogs are more than likely being influenced by how they feel physically in their body. We cannot rule out pain, and we can't ask them directly to tell us how they're feeling. Just like it's not uncommon for humans to go to the doctor and have their exam and lab work come back normal, but they're able to say, I don't feel right. The same thing can happen with our dogs, and does happen with our dogs, except they're not able to tell us directly, I don't feel right. It shows up in their behavior. Musculoskeletal issues, GI issues, allergies, dental pain. So much of this is not going to show up on a typical exam and your annual blood work. It doesn't always look the way we think it's going to look, like a dog who doesn't want to run and play. It's not usually big, overt gestures like a dog refusing to go on the walk or guarding their body. It's not usually something that we can just press on their body and say, well, my dog didn't yelp. But these are a lot of the reasons I hear from other people, including professionals sometimes, saying the dog can't be in pain. But we know differently now. It's just not widespread common knowledge. Although it's getting there.